Well, thank you, Dr. Brandt and Dr. Hodge. The first question comes from Greg Ingram. Can I still use my designated technician with the HDC template? And I believe Dr. Hodge can answer that question.
Yes. The way the technicians are assigned in Costa Rica is that a doctor only actually has a designated technician if you've achieved Premier or Elite status. So if you don't have that status, you don't actually have a designated technician. So they're switching over to the group of Elite technicians is actually going to be an enhancement for you. It is only that group of technicians that have been cross-trained on the templates, so it is going to be best to use that group of technicians in order to get the predictable outcomes. So all the cases will be treated by that group of technicians.
All right, I think you can answer this next question. It comes from Richard Strauss. Will the preference defaults given today match those given at our Clear Essentials course from Dr. Moralia in St. Louis back on the 10th? I've already changed my preferences to those. Do I need to rechange them based on this presentation?
That's a great question, Richard. And the beauty of this is this whole process has been in development for several years. And Dr. Moralia is our designated speaker of preference for our Clear Essentials 2 because all of his treatment philosophies are in alignment with what we've selected for these templates. So if you changed your templates to match Dr. Moralia's, what he was recommending on the 10th is exactly what we're recommending in the downloadable handout that's attached to this webinar of recommended preferences. So you will not need to change those again.
Wonderful. The next question comes from Jaden Kumar. Do we need to take photographs after marking the occlusion with articulating paper? Dr. Brandt, you might be able to answer that question.
So the idea would be to mark the teeth before you take any photographs. So that's the idea is really to get the occlusal photographs with the articulated mark. So articulating paper first, then take your photographs. And that way, when you do submit your photographs, upload them just like you normally would. These are not some extra photographs that you need to take. We'll be able to use those down in Costa Rica. It's not only check bites, but here's something else you're going to be able to use them for. It'll also give you an idea each time the patient comes back into the office on their recall appointments when you check treatment progress. You can actually use the articulating paper again to kind of monitor treatment somewhat in terms of are the teeth that I didn't move still contacting, and are the teeth that I'm moving, and are they out of the way, and do the articulated marks look different? So there's a number of reasons why we want that, but mainly it's there to initially to set the bite and so that you can verify that bite when it comes back to you when you receive your ClinCheck, and you can look at your records and the ClinCheck and verify that bite.
All right, thank you very much. Dr. Brandt, I think you might be able to answer this question as well. It comes from Sean Sun. How would this work with patients who are missing teeth?
So most certainly the way the technicians view this, the way that technicians do this is very, well, it sounds like I got a bit of static. And is that from my end or your end?
I think it's from your end, but you can keep talking.
Okay, so most certainly what we do many times as the technicians, they'll actually simulate the teeth. They'll actually put in teeth that are missing while they're treating the case, measure the distance, measure the space that are there. So it really shouldn't be that much different. I mean, it's obviously if you're only got cuspid to cuspid, or you've got only first molars, and then you've got from first bicuspid to first bicuspid. The technicians are looking all the time, and those spaces are measured, and those spaces, if you want to maintain them, they would be maintained, and they would be trying to create symmetry. So it really doesn't complicate things at all. Just assume that, you got all those teeth are going to be replaced in the future, and build that into your treatment plan, because that's kind of how the technicians view it. And that's a good thing that you'll actually want to put also into your special instructions, kind of what your plans are for replacing those missing teeth.
All right, we've got another question from one of our doctors. I just submitted 2 cases. Should I complete this form and upload? Also, should I have patient return for new photos with articulating paper?
Well, I would say that if the cases are already submitted, I'd let them go ahead and process rather than run the risk of delay since the patient's going to be waiting for the ClinCheck. If you look at the ClinCheck when it comes back and you feel that the initial bite set was off, then I would take new photographs. But I don't really see the need to go backwards on this, but just go forward as of Monday morning or Tuesday, considering Memorial Day holiday. But make sure you're marking with articulating paper on all your future cases, and then take advantage of the template grid for new cases going forward.
We've got another question regarding the template. Can the template be applied to ongoing cases?
The templates are for use in designing the initial ClinCheck. You could use it if you're doing a refinement or a mid-course correction and implement it that way, and you just would upload it in the X-ray section as indicated in the webinar.
We had another question come in by email. It says, I'm still a little confused about determining the malocclusion using first bicuspid as the reference tooth. Is Engel's classification using the upper first molar outdated or complicated to use as the reference tooth? I'm more comfortable using the upper first molar as a tooth of reference. Let me know if using the first bicuspid is easier to use and why. That's a great question, and as far as the templates are concerned, you can use either the molar typical Engel's classification using the molar as a reference point, the mesial buccal cusp of the upper first molar into the buccal groove of the lower first molar. The fact that we are often not changing molar position makes the bicuspid a reference point that is fairly universal. And as Dr. Brandt was pointing out, and he actually is now teaching to some of the orthodontic residents, the thought of using the first bicuspid as a more realistic reference point is something he advises. It's not a requirement, so you could use either reference point in doing your templates. Just be consistent, and it should work out fine. So you can go with your personal preference on that. Another question by email says, the template guide that you showed in the webinar is in color with the red, yellow, and green dots, but we only have black and white printer. Is that a problem? No, that is not a problem. You can print the template guide in black and white and just make your notations on that, and the technicians won't have any trouble interpreting that. The color is just one for the sake of simplicity, but the numerical classifications that are inside those bubbles are discernible in black and white and work fine. So that's not an issue at all.
I want to again thank Dr. Brandt and Dr. Hodge for a great presentation, and for all of you taking time out of your Friday to join us, and we look forward to seeing you on another Heartland webinar in the future. Thanks very much.